My name is Yvonne Rosales. Today I am presenting a 50-year-old divorced Hispanic female nurse who presents with an acute onset of abdominal pain. My patient was in her usual state of excellent health until 2 to 3 weeks before today's visit. She said that back then she started developing an unexplained abdominal distension, pain, cramps, changes in her bowel habits. She denies any bloody stools though or vomiting. She says that she's feeling weak, fatigued, and even depressed. My patient says that all these symptoms worsen when she eats spicy foods or when she undergoes a lot of stress. She is currently working at night shift at a local hospital. She is the main provider for her 3 kids, and she is still going to school. She says that her pain has intensified for the past 2 to 3 days. She says an intermittent pain that it starts at a low intensity and it escalates all the way to a point that she can't stand it anymore. She says that she even had to be sent home from her night shift. She says that about 2 to 3 weeks ago, she started noticing mucus-like stools, and she will have bursts of diarrhea and constipation at the same time. She's also complained of having poor appetite. She lost 5 pounds in the past 2 weeks. She describes her pain as being in all 4 quadrants, and she describes this as a sharp stabbing-like pain that usually starts, like I said before, at a low intensity, and it escalates to a point that she can't stand it anymore. She usually takes for her pain, she takes Tylenol 1 gram every 4 to 6 hours, and she says that if she cuts down on spicy foods and sometimes caffeine, then it gets a little better, but it doesn't really go away. The patient denies taking any other over-the-counter medication. She denies taking NSAIDs or anything like that. The only thing she takes is the Tylenol. Her medical history consists mainly of hypertension and hyperlipidemia, and according to her, she has a record of her blood pressure, and she really hasn't noticed any differences. It's been between 120s, 130s, over 80s. So for the most part, she's good on that side. Her review of systems, it's unremarkable. On her physical exam, she's very pleasant, and she is a reliable historian. She is in no obvious distress. Her vital signs are normal. On inspection of her abdomen, I don't see any discoloration. I didn't see any jaundice, cyanosis, redness, any palpable masses. The contour of her abdomen, it's round and symmetrical. It's a slightly distended and tender, but it's only tender to like deep palpation. At this time, based in all her symptoms and her ultrasound, we did an abdominal ultrasound, and it shows no abnormalities. We also checked her CBC, CMP, and all her labs, cholesterol panel, and they all came within normal limits, except her VUN and creatinine. The creatinine, it's 1.4, and the BUN is 40. For everything else came out within limits. So at this point, based on her ultrasound, all her symptoms, and her lab results, the diagnosis for me at this point is irritable bowel syndrome. My plan for my patient is to do some lifestyle changes, such as dietary changes, habits. Maybe she can cut down on spicy foods, on caffeine. She really doesn't exercise, but whatever she walks at work. So maybe if she can't, we can teach her on an exercise regimen, maybe 3 to 4 days, walking 30 minutes. That will help her a lot. She needs to increase her intake of water. She looks a little bit dehydrated. The other thing we're going to do with her is we're going to start her on a proton pump inhibitor. We're going to start Protonics 20 milligrams by mouth daily. We're also going to have her continue her lisinopril 5 milligrams daily for her blood pressure, as well as her hydrochlorothiazide 12.5 milligrams daily, and her simvastatin 10 milligrams daily. We're going to have her come back in 3 weeks and then see if her symptoms improved. If we don't notice any improvement, then we may send her for a CT of the abdomen and refer her to a gastroenterologist. Thank you.